approximately 350 million adults, and I actually think that that number is probably a little bit low, that are suffering from clinical depression. In the United States, we're looking at approximately 17 million people, and again, I think that that number, that statistic, is probably low as well. 40 million adults in the United States are really suffering with a variety of different anxiety disorders, which has taken over the #1 mental health issue in America. So, needless to say, there are some critical mental health issues, and of course, people have to be willing, and I talk about this all the time, to be serious, to acknowledge, address, and resolve.
So we had a hypothesis, and I know all of you in the room, even the men, are going to agree that women can change the world. When there was no screening recommendation for breast cancer, who changed that? It was women. So yes, we need new policies for detection and diagnosis of Alzheimer's. We need providers to be educated about what they can do. And I'm talking about the providers that we see more often, like the OBGYN or the family practitioner, who the research shows they are less comfortable talking about cognitive assessment. But the way for change to happen is to create consumer demand. And we've seen women be the change makers in our lives on healthcare again and again and again, and it's time that we put Alzheimer's at the top of the list. So we partnered with a national nonprofit organization. We did a survey. We surveyed women between the ages of 35 and 75, and we said, what are you thinking about with your brain? We had a hypothesis, which is the brain is the most forgotten organ. It's the one that we talk about the least. It doesn't show up in our healthcare conversations. We're certainly not talking about it. Maybe we are with our close girlfriends, but we're not talking about it as regularly as we talk about so many other healthcare issues like heart disease. Now, February, everybody's wearing red, right, for heart disease. It's a great accomplishment. We need to do the same thing with Alzheimer's. So what we learned was 8% of the women we surveyed were talking about their brain health. 67% said they wish they knew.
I'm really thrilled to go after Edie and Brooks because it's just a natural segue into the work that we do at Sharp Again Naturally. How many of you are concerned about your own cognition? And how many of you think there's something that can be done to actually reverse dementia? So that's great. I'm sort of speaking to, preaching to the choir here, but the information may help others as well. So I'm one of the founders of an organization, it's a nonprofit called Sharp Again Naturally. We're based in Westchester, and we were formed 7 years ago, which is before all of this brain health awareness started, to educate the public and the medical community about the causes of memory loss and what can be done to prevent and treat them, and potentially reverse them completely in many cases. And so we have a medical and dental advisory board that we work with, and we really conceived of ourselves as a clearinghouse to bring all the information together on many of the causes of memory loss that are on our palm cards back there. And we have 10, which are really 12, two are kind of embedded in this list. And I'll just briefly go over them, but many of them being mentioned. Things like nutrition and exercise. I have to say, if there's one thing, people say to me, oh, there's one thing I can do. I say, exercise. Because exercise, we'll get into it, but relieves stress. And exercise helps us sleep better. And it really allows the brain to rid itself of toxins every day, every night. And so some of these causes that we've identified really can be helped by exercise, but most importantly, as Brooks has said, we're now about prevention. So we've been doing this work for 7 years, and I think it's fair to say the research shows that for people with mild to moderate cognitive impairment, they're seeing much better results.
They wish they knew how to take care of their brains. 69% said, I want to talk about this with my doctor if only I knew how. So for those of you with a public health, or even if you don't have a public, the data is pretty obvious, that's a grand opportunity. Low level of discussion, high level of interest. So we created a campaign. I won't bore you with all the concepts that we looked at, but where we landed was on a campaign called Be Brain Powerful. Be Brain Powerful is designed to educate women about what they can do to take care of their brains. It's designed to have a new conversation. Conversation starters you can have in your communities, with your families, in your workplaces, in forums like this, for which I'm so grateful to be here, and to actually start taking care of our brains. And we launched in New York in November, soft launch. Former First Lady Laura Bush is our honorary chair, and we partnered with Women's Day magazine.